Good morning, everyone. Thanks for joining us here at our session. So we hope you enjoyed that opening. Certainly a unique way to be at our presentation and our seminar and conference this year, right, Robert and Kevin? But it's exciting to be here with you. We are going to talk today about what we've learned from COVID-19, and we're going to talk about that together. So if we go to the next slide, we'll tell you who is going to be speaking. My name's Tron Emtage. I oversee clinical programs at Optum, Workers' Comp, and Auto No Fault. And I'm joined by Dr. Hall. I'll pass it to you.
Yeah, thanks, Tron. It's great to be with everybody today.
And finally, Kevin, you want to introduce yourself?
Tron, Kevin Trebo, work in the Public Policy and Regulatory Affairs team here at Optum, Workers' Comp, Auto No Fault.
And Kevin is our slide master today. So thanks for driving the slides, Kevin. Why don't we move on and we'll get started. Let's talk a little bit about the pandemic. We all know the last 20 months or so have been unprecedented. We've changed how we live, how we work, play, worship. We could line all of these up with the same categories as some of the social determinants of health that we've been talking about in many seminars and presentations throughout this year. And I would dare say that might be some important things to think about and keep in your mind as we go through our presentation. If you start with the unknowns of 20 months ago, now fast forward to today, we still have a lot of unknowns about COVID and its effects, some of the long-term, I think we hear long-haul COVID kind of things that are going on. We don't know exactly where all of our claims are going to land. And we're struggling even now to return to normalcy, right? What does that normal mean? Is it a new normal, or will we get back to what we knew pre-COVID and pre-pandemic? And it's affecting all aspects of our lives. But stop for a moment. Think about those around you that have additional challenges and struggles in our modern life and kind of our society for today. This past 20 months or so have highlighted disparities in our culture, our neighborhood, our city, states, nation, and even our world, right? We learned that normal is subject to dramatic shifts and changes really in an instant, in a heartbeat, right? Stop again. Think about those that we serve, that we live, how we work, right? Think about when you leave for work, even today, or someone you know leaves for work even today, because many of us are in this presentation and in this seminar from home, right, today, online. But think about those that leave and don't come home from work because they were injured on the job. On a day they thought would be like normal, right, and that they would return home, they don't. They're injured on the job, their lives change from what that moment forward, right? It's different. Maybe it isn't a dramatic change, right? One that only sets them back a few days or weeks, not months or years. But for others, it's going to be a real dramatic change and struggle. It's a big shift in our industry. Kevin was showing some of the big numbers that we saw on that last slide. Today, COVID still impacts us as an industry, a nation, and a world. We think about the logistics that were needed to deliver all those doses he was showing you, right, of vaccine that were administered. Wow. Think about the disruptions that we all experienced, the lack of yeast. We couldn't make bread at home for those of us who like to do that, right? We ran out of toilet paper, meat, bread. Think of today. I hear, my kids are all grown, but I hear that there are toy shortages going on today. There's staffing issues in our hospitals, in our delivery systems. There's delays in the mail. It's hard to get things. If we look at that next slide, we know that there are challenges with staffing and unemployment all around the country. And as you look at this, you see the different colors and the different rates of unemployment across our country today. Everyone is impacted. The rise of or better awareness of mental health issues and the importance in taking care of oneself through unemployment or through employment and through what's been going on is super important. The shift to loneliness, awareness of isolation that so many of us listening to this presentation now understand a little better than maybe we did a few months ago. Stop again. Do you relate better to others? Do you relate to those that we're serving better? Do you think of, like this unemployment says, do you think of changing your work, being part of the great resignation, as we're hearing it called in the industry and in the media? Do you think of calling someone for help, a therapist, a neighbor, a friend, a family member, someone that can help you think through the struggles that you're having? Suddenly, all of this is real for us. And are we using this to better and think about our injured workers that we're serving and helping them in a better or different way? COVID has impacted all of us. And over the next few minutes, we're going to talk to you about some of the things that it has affected. And we're going to start with Dr. Hall and the body. Dr. Hall?
All right, thanks, Tron. So through all of this, almost 2 years now, what are some of the most important medical lessons we've all learned from COVID-19, and how has that, what we've learned, changed our thinking, our understanding, and about COVID-19, and how we manage patients with long-term COVID, like Tron mentioned, like long COVID. And lastly, there were to be if there were to be a new COVID mutation, or if there were to be another pandemic, how would that play out in the future? What have we learned today from COVID that we could use to help us with a future pandemic or another mutation? Go to the next slide. One thing to say for sure that we've all learned from COVID, medically speaking, is that it's different. It's been different from other infections from the beginning. And while COVID has some similarities with symptoms when compared to other respiratory conditions like the common cold or the flu or even seasonal allergies, there are some symptoms that have set COVID apart, excuse me, from these other conditions. For instance, COVID can cause shortness of breath, which you really should not see in these other conditions listed here, like the flu or the cold or allergies. On the other hand, COVID doesn't usually cause sneezing like you see in the common cold or seasonal allergies. And then don't forget early on in the pandemic, before testing was widely available, what were doctors and nurses asking patients before they came in? They were asking them if they had lost their sense of smell, or if they had lost their sense of taste. That's how they were testing patients over the phone before tests were widely available, to see if they were at a higher risk for having COVID. So knowing the differences in symptoms between one condition and another can really help identify those people who have been infected with this disease and with other diseases potentially down the road, being able to compare their symptoms to other conditions that may cause similar or different types of symptoms before testing becomes available. Next slide. And then something else that we've learned early on medically was that people with certain risk factors were more likely to have severe outcomes if they were to be infected. Some of the medical risk factors for worse outcomes, as you may recall, included those patients with certain comorbid conditions, things like being overweight or obese, or having diabetes or high blood pressure, or pre-existing lung problems or weakened immune systems. And then there were those non-medical risk factors that were identified early on. Remember when we characterized our older age population as our most vulnerable? Remember that the older adults were the ones that had the most severe disease early on with this. And then we also found that people from certain race and ethnic backgrounds were at a higher risk of having more serious infections, like African American and Latino Hispanic patients. So again, there were those medical and non-medical risk factors that were identified early on. And so although there's no guarantees, learning which population groups are at a higher risk for severe outcomes allows those specific groups of people to be prioritized for medical observation and treatment and prevention early on. Next slide. And we also learned the importance of testing and how challenging it can be to get people tested early on in a pandemic, because remember, there was a period of time when there were no COVID tests and the availability of testing was extremely limited. And the accuracy of those tests early on was questioned, whether or not the results were true or accurate, or whether or not they were false positives, false negatives. And then there were patients waiting for days or even longer to get their test results. And they may have been continuing on with their routine activities until they waited to hear back of whether or not they were positive or negative and potentially infecting other patients. And so then there were also these high costs that we all saw. So some of these testing companies had charged hundreds of dollars, even more per test, that also went along with these early tests. But once the accurate testing became widely available and was affordable, and there was this better ability to identify those patients who had been infected, We also had that ability to help encourage them to isolate themselves so that they would not continue to spread the virus to other people. Next slide. We also learned early on that COVID could cause symptoms like coughing, shortness of breath, even pneumonia, like I mentioned earlier. But we learned that COVID, again, was very different and that it could have more widespread effects on the body and not just the lungs, like cardiovascular symptoms, things like heart attacks, blood clots, unusual problems with the nervous system, things like confusion and having a stroke. And then there were other effects on other parts of the body, like injury to the kidneys, even to the point that people with COVID might have to have dialysis while they're in the hospital due to kidney failure. And then from the standpoint of other infections, co-infections that can also occur while that person is infected with COVID. I had a patient tell me just last week that her son died from a fungal infection while he was still in the hospital recovering from COVID. So again, COVID is very different. It's a different virus, it has different complications even early on in the illness. Next slide. But what about the chronic complications of COVID? Because we now know, as Tron mentioned earlier, long COVID, where there can be these long-term cognitive challenges, things like decreased concentration, memory problems, depression, and anxiety. Chronic physical complications have also been identified with symptoms like chronic fatigue, shortness of breath, and coughing. Some patients are still having heart palpitations even months after their initial COVID infection. And so knowing about these potential long-term complications has also allowed us to help plan for these different types of treatments and services that these patients with long COVID might need. Next slide. And we've seen how COVID-specific treatments could be identified and developed early on with a high level of urgency, but with safety still being the highest priority. Now, as we all know, early on there was some confusion about certain medications that were being prescribed to either treat or prevent COVID that were later found to be either not helpful or potentially unsafe. We also saw how steroids played an important role for these patients who were really sick in the hospitals by decreasing the level of inflammation in their body that had been caused by COVID. We saw medications like monoclonal antibodies being developed and used in the really sick patients that helped them turn the corner. And lastly, we've seen the development of antiviral medications used to treat COVID patients before their symptoms become severe. Even this recent announcement of an antiviral pill that's been developed and was actually approved in the UK just this morning. Next slide. We also learned that the preventative measures used to stop the spread of other respiratory viruses like the common cold and the flu, they could also be used to help prevent the spread of COVID. Precautions like social distancing, wearing masks, practicing good hand hygiene, as well as getting vaccinated if possible. Remember that these are all the same recommendations used to help prevent the transmission of other respiratory diseases. So don't forget to get your flu shot this season if you're able to do that. Next slide. And lastly, we learned about this psychological impact that COVID has had. It started with the fear of the unknown, which we all had. We all had this fear of the unknown, which led to anxiety and which led to more worry. And as people started dying from COVID, we started seeing more grief, more blame, more anger. But at the same time, there were these other psychological symptoms brewing too that Tron mentioned, these financial stresses of having to shelter in place or losing a job, or even the requirement for parents to stay home with their kids for remote learning or homeschooling. And we also saw, and we are still seeing, other psychological effects of the pandemic, things like domestic violence and post-traumatic stress disorder. And those psychological effects will likely be with us for a while. And so overall, whether it's acute or chronic medical complications or the psychological impact of COVID, hopefully we now know what to be looking for and how to treat it and how to prevent it. And now I'm going to turn it over to Kevin, who's going to speak about the lessons learned from the state policy standpoint. Kevin?
Thank you, Dr. Hall. As Tron mentioned earlier, he had some good points when he said, let's all stop and kind of focus on various different things that impacted us all during COVID. Well, I want to ask you to do the same thing. Stop and think about, in our world, we often kind of focus on the delivery of ancillary pharmacy medical care, medical services. But the workers' comp world is much broader than just medical services. So stop and think about at the beginning of this pandemic, you have employers that are sending their employees to work at home. You have state legislative bodies that are trying to get basic things like budgets done and then to adjourn for the year because of the fear of the unknown in the early part of the COVID pandemic. So think about the fact that you have a multi-million-dollar state workers' comp agency that handles everything from medical bills to filing of new claims to hearing on existing claims to arbitration to you name it. And all of this needs to be immediately shifted to work at home, and it doesn't stop. Just because the COVID virus is here and spreading and causing disruption doesn't mean that the work of the workers' compensation agencies in the states and all the medical providers stops. It continues to go for the injured workers. So, what we saw early on, as I mentioned, is that the 2020 legislative sessions were shortened. They wanted to get the work done and get out. We were still doing the social distancing. We were still understanding the whole impact of the pandemic. We didn't know as much as we do now. So they focused on the budgets, right? Getting the budgets done, getting them out the door, and getting the legislature to adjourn. We had a lot more budget issues that have caused deficits because you're seeing funding issues for municipalities, for state agencies, again, to work at home, for school districts, for your local city, police, firefighters. And it really kind of diminished any of the chance for work comp reforms, formularies, and some of the other presumptions for workers' comp that we thought we would see in 2020. And that impact, as I'll talk about later, has continued into 2021. The agency, right? They saw some reductions in their funding. A lot of the state agencies received some of their or portion of their funding from work comp premiums. So they had to deal with reduced staffing, which the work didn't stop, but the staffing needed to continue. They had to switch from work to home. So you have all of these folks that work at the state workers comp agency in Nashville or Austin or Tallahassee, and all of a sudden now they have to shift from in building to work at home. This really put a crimp on some of the ability to do rulemaking around some of the significant regulatory issues. And again, it kind of shortened some of the reform efforts or some of the projects, and I'll talk about those in a little bit. So, two examples of what were delayed, policies that were significant that delayed were the drug formularies in specific areas. Montana had originally scheduled their formulary to take effect on April 1st of 2020. Well, obviously April 1st of 2020 was when the real part of the pandemic was growing and we were still trying to figure out what was going on. And so what they did is they could have delayed that process until the COVID-19 crisis passed. Now, I'm glad to say that by today, they have implemented that process as we've gotten into 2021. And then New York, right? So New York had their drug formulary. Part of it went in December of 2019, so before the pandemic hit. But the second part, applying to those legacy claims, those claims that were having refills and renewals, was supposed to take effect on June 20th. That has been delayed at least now for the time being until January 1st of 21. Then it was delayed again into July 1st of 21. And now we're looking at possibly sometime in 2022 before that second phase of the formulary is put into action. So the growth of presumptions, right? So we saw that you had folks that needed to work, right? So we saw that there were this trend of presumptions growing for first responders and firefighters. A lot of it was around PTSD or certain cancers. So PTSD, the presumption for PTSD among first responders was rising in late 2019, early 2020. They see a lot of traumatic issues when their work. They go through a lot of traumatic mental stress in their work. So that presumption was growing and was kind of taking on a new form. Well, along came COVID, and you have those frontline workers, your healthcare workers, your firefighters, EMT, those considered to be essential, nurses, people that work in hospitals or clinics. They still had to continue to do the work, but there was the fear of, what if I contact uh, this this disease through my workplace? I'm a nurse or I'm a firefighter and I have to go out to a call. So what the states did to protect these workers was to create these presumptions. So presumption is really meaning that it's the nexus for these claims. It's saying that without your continued place of employment where you were in a higher exposure level to COVID-19, you would have not normally contracted COVID-19. So they created this presumption to provide protection, and it started to fall under the workplace injury or illness requirement for workers' compensation. Now, some of these were very tightly put together. It focused just on healthcare workers or what they call first responders. And other states had something that included essential workers, which we may view as essential. You have folks at the grocery store, you have folks at the gas station, folks that deliver the gas, folks that deliver all the truck drivers that deliver all the supplies to the stores. And one of these was California. Theirs was going to be rather broad, and the estimate was that if they included the large swath of employees, it could have been about $11 billion impact to the system. So containing the presumptions is a goal that I think the states are looking at, but still providing that protection for the workers. So there was really two ways to look at how these presumptions are done. Some early on, so in 2019, those were done through usually administrative action by the Department of Insurance or your Division of Workers' Compensation, or even executive order by the governor's office. Um, into 2022, we started seeing more of a legislative action. So the legislature would come in and they would define in the labor code what was considered to be an occupational disease, who was considered to be this essential worker. So they could narrow the scope of that presumption to you, as you see in Minnesota, your peace officer, firefighter, paramedic, nurse, or healthcare worker. In Wisconsin, so you had that diagnosis was required for a COVID-19 positive test in order for you to avail yourself of that presumption. Arkansas in 2020, Illinois was an example of an emergency rule that was put in place by the governor, and it covered frontline workers. Eventually, that became a legislative bill and was passed later on in 2020. So here is kind of an example of the COVID presumption. Now, this doesn't cover every single type of employee. This is really kind of a generic ranking of the states and what they've done. As you can see, there are legislative states. There are some that are emergency declaration by the governor or Department of Insurance. Some are existing agency rules that they put it back into place. And then some states have not taken an action to date. But as you can see here, a vast majority of states have created some type of presumption for those workers who are exposed to COVID-19. So what do we see in 2020? Well, COVID legislatures could be more active. They could be looking at work comp reforms. In several states, it's been 5, 6, 7 years since they've done work comp reforms. It's been almost 2 years now since many of these states have had a full legislative session. But again, COVID is going to kind of take up the air in the room. Will by 2022, as we get into the legislative session and in the early part of the year, March and April, will we have kind of crossed that river and gone into a situation where we're kind of back to normal? You're going to have ongoing budget deficits in the states because of unemployment, all the cost related to COVID. Those will be looming and will be part of the budget fights. You have your federal and state elections coming up in 2022. We've seen the changes that have taken place in 2021. And usually going into an election year, a lot of the state legislative bodies tend to quiet down just a tad on big items or kind of the scratchy items like workers' compensation. State workers' comp agencies will continue to probably embrace distant hearing procedures. So a lot of that is now telehearings. That's been a great development of, the kind of the silver lining. They're going to look back on their budgets, of course. And then the question around telemedicine. Telemedicine has really been a boon in the COVID, not only for general healthcare. I'm sure we've all experienced some kind of telemedicine in the last couple of years, but now in workers' compensation, it's becoming a way to ensure access for injured workers, but at the same time, make sure that they don't have to expose themselves and others to possibly transmitting the virus. So now I will send it back over to Tron, who can give us an idea of so far what we have learned and where we're going to go from there. So, Tron? Did we lose Tron? Stephanie or Dr. Hall?
Yeah, I think Tron is muted.
Okay. I didn't know, maybe I somehow disconnected while I was speaking.
We can go ahead and advance the slides, and I'll take over here if that's okay, Tron. Why don't you go to the next slide?
Sure.
Thanks, Kevin. Yeah, so really, as Tron and Kevin both mentioned, working from home, this has become the thing that people have had to become accustomed to, and looking for those different types of ways to make it work. There have been modifications that we've thought about potentially to help people with their homework environment, things like ergonomic modifications to help them not develop things like back pain and carpal tunnel syndrome and all those things that we never had really to think about before. And then specific formularies, knowing that people with COVID, they're going to be at risk for certain types of symptoms, and what drug formularies might be most appropriate for them, what types of medications might be most helpful for them to help get them through their illness, whether it's medicines to help control coughing, or if it's medicines to help control pain or nausea from the medicines that they're taking, all of those different things. And then as Kevin mentioned, telemedicine has become a part of the way of providing healthcare, and I believe we believe it'll be here to stay. And then all of the different protocols that have been put in place since then. Tron, are you back now?
I am, but finish out the slide. Go ahead. I'm not sure what happened. We've learned to be resilient, and we kept going. So thank you.
There you go. Yep, there you go. Yep. So what we've learned from COVID too is that we have seen a decrease in claim volume from a workers' comp standpoint, knowing that many people have not gone back to full-time employment, and therefore there's not as many injuries that are occurring out there. And then in terms of the chronicity of these cases that we do have, some of them are getting much longer as people are just still not recovering from their initial injury. And in some cases, it could be, in some cases where there has been a delay of care, where that patient's maybe not had some difficulty with getting back in to see their doctor or have a certain procedure done just due to the backlog that occurred as a result of COVID. That's still a possibility out there too. And then just knowing that the environment is changing, everything continues to be in a state of flux, even this far in, that makes it to where communication remains to be a key, though. Next slide.
Yeah, that's right. That's right. And Dr. Hall, thanks for that. And thanks for taking over there. Like I said, we've all learned to be nimble and to keep communicating. And I was just going to underscore what you said there at the end. Part of my notes and comments was that we've learned that actively listening, communicating, talking, sharing, and making sure that we kind of over connect is so vitally important, right? As information comes flooding at us, the nimbleness you talked about, the changing environment, and making sure we're sharing, which I think is what we want to do with our injured workers as well, right? Share with them the process, share with them what's going to happen, share with them information so that we can remain nimble. So I think this last year has taught us all how to do that. And understanding your data, like you said, I would just underscore that as well. The data might look like something has dramatic claims in our claims management when I know when we looked at some of the pharmacy data from 2020 and even 2021, we saw some dramatic changes. And it was really because we didn't have those new claims coming in, because we did not have workers working in the field, out of the house, and getting injured. And it diluted some of our, or it changed kind of the dilution of new claims that are not severe, and really changed some of those metrics that we look at normally. We had to look at them differently. So again, staying nimble and changing with your environment, so important, I think, is what we learned. And I think we all learned we didn't need 100 different types of toothpaste, right? Whatever was on the shelf, we'd take home and it was okay. But thank you so much for your time today. I know Kevin, Dr. Hall, myself, we appreciate you listening in. And if there's any questions, we're more than happy to take them at this time. And I think they show up. If you have any, I believe you type them into the session and they will show up for us. We'll give it a minute here. All right, not seeing any questions. If anyone has any lessons learned, we'd love to hear that too. Did we miss one? Was there something that came across your desk, your life over the last 2 years that has changed, or are you doing something different as you work with your injured workers that you believe will become a best practice out of the last 2 years and out of the pandemic? I have certainly learned I do not need to print nearly as much stuff as I used to. I used to think I had to print everything, and this year has definitely taught me I don't need to do that. How about you, Dr. Hall? Anything you've learned this year?
A comfortable chair is important.
Agreed. Agreed. And eye drops are your friend when you are on video calls all day long. I've learned that too. Kevin, how about you?
I have learned I have continued to go into the office, and I have learned to keep multiple masks in my desk drawer. So that, because, then when you're in the office in the public areas, you're wearing a mask, obviously. When you're office, you're not, but I make sure to keep multiple so that I'm never not without one if I need to, use the microwave or the restroom or something in the office. Yep.
Nice. I saw someone hang one right on their door on the inside of those little command strips. I thought that was pretty amazing. Good idea. Excellent. Well, thanks so much to the viewers who have been with us. Thanks so much for joining the awards gala. Thanks for being a part of this. Thanks for surviving the last 24 months. Keep up the good work. And with no questions, I think we'll turn it back to our moderators here.
Thanks very much.
Thank you.